The VRA is very affordable. It is very quick to do, and you get the results there and there. So we don't have a reason why we should take ourselves through the devastating effect of cervical cancer when these screening tests are available.
A liquid, we spread it on the cervix, and if there are any abnormalities, we get specific color changes, and we are able to institute further management depending on whether it's positive or negative. Yes. So for everyone, or for all women, there is a test that they can actually have, and we really encourage them to go for these tests. They are available everywhere, even in the lowest hospital levels.
Welcome to Wellness Health Services Health Talks. I'm Dr. Joshua Derito, a family physician. I have interest in cancer prevention and treatment, and also public health. Did you know that cervical cancer is one of the cancers that can be easily treated and eradicated with simple screening undertakings? Today our talk will be on cervical cancer, and we are privileged to be joined by gyno-oncologist Dr. Moita. Welcome, Dr. Moita.
Thank you very much, sir. As you have heard, my name is Dr. Buruna Moita. I am a subspecialist. I am a gyno-oncologist. That means that I deal with female reproductive cancers.
Thank you, Dr. for that introduction. Today our talk is cervical cancer. And cervical cancer, unfortunately, is one of the cancers that is devastating our women, especially in the low-income countries. So tell us what is cervical cancer, and what causes it, and how does it present itself?
Well, as you have said, cervical cancer is quite a devastating disease to the patient herself, to the spouse, to the children, and to the community at large. And there's something important you had mentioned. It shouldn't be this way, because this is a preventable disease. As a family unit is actually suffers a lot in terms of the social aspect of it, financial bit of it. Mentally, they are really tortured. Yes.
Okay, Dr. Muita, tell us about more. What causes cervical cancer, and how do we go about it?
Well, first of all, before we get there, I usually always want to equate or rather compare cervical cancer to an all-time favorite story in the Bible, that of David versus Goliath. So if you remember in the story, Goliath was a giant, by no means a huge man, a beast, quite feared by the Israelites and those around him. He was considered unbeatable in anything, and that is what people consider cervical cancer to be. But in actual sense, Goliath was beaten by a small boy by the name of Goliath. So David. So basically, he had a weak underbelly, if we may call it that. On the other hand, David represents leadership, that is brave leadership, someone willing to fight for his people. His sling and stone actually represents the policies, the commodities, the human resource, the financial bit of it that we use to fight cervical cancer, and this will range from vaccination, screening, and even up to treatment, including the palliative treatment of it. Cervical cancer is actually caused by a virus that we know as human papilloma virus. The high risk types. We have the low risk types that cause things like warts. So we have almost around 14 high risk types, and HPV, human papilloma virus, is actually spread through sexual activity. So both men and women are actually affected by this virus. So the commonest type that actually brings about cervical cancer are the type 16 and 18 that would cause around 70% of cervical cancers eventually. And not everyone who is infected by HPV actually develops cervical cancer. So 95% of people who get infected by the HPV virus are actually able to clear these from the system. But the other 5% who have what we call persistent HPV infections are the ones who may go ahead and get the cervical cancer at the end of it. Yes, and usually the HPV induces changes in the cervix. So the moment you get the initial changes in the cervix to cervical cancer, it actually takes a long time. It may take 15-20 years before you develop the cervical cancer. And this is the time we actually take the opportunity to do what is called screening, so that we are able to catch the abnormal cells or the early changes that may lead to cervical cancer. So screening is a very important component when it comes to cervical cancer prevention.
Thank you, Dr. Moita. You have talked about almost 70% of the people get infected with the human papilloma virus, but only 5% of the women who get human papilloma virus are likely to proceed to have cervical cancer. So what puts these 5% of the women at risk of getting the cervical cancer? So what are the risk factors?
The risk factors. Okay. So as we said, HPV is a sexually transmitted disease. So events surrounding sexual activity, early sexual debut, that means for those who start sex very early, they are at a risk of acquiring multiple strains of the HPV. We are talking about multiple sexual partners. So the woman might have multiple sexual partner, or the spouse may actually have multiple sexual partners, and may actually spread this to the spouse, to the female spouse. Smoking is also an important risk factor. Low social, economic status, and lack of screening. Lack of screening is also a big risk factor for cervical cancer.
Wow, that is very interesting. You have seen some of the risk factors that put women at the risk of getting cervical cancer. So what are the available screening methods that our women have that enable them to get to know whether they have cervical cancer or they are at risk of getting the cervical cancer?
Well, very good. From the public health perspective of it, screening, as we said, is a huge component in the fight against cervical cancer. So the commonest screening methods, number one, is the pap smear. So pap smear, usually the objective of doing a pap smear is actually to detect the early changes in the cervix that may eventually lead to cervical cancer. The common narrative that we get from the population outside there is that pap smear you're doing a pap smear to find,
For
to look for
cancer.
to look for cancer. You know, that narrative usually scares people away from doing it. So we are looking for the early changes that may lead to cervical cancer. And remember, as I said earlier, by the time you're getting the very early changes in the cervix to getting full-blown cervical cancer, it takes time, 10, 15, 20 years. That's quite a long time. So it gives us time to actually pick these out and institute proper management. But also, on the other hand, if you have early cervical cancer very early, the pap smear can actually pick it out. So again, that is very, very, very important. We do pap smears, usually also dependent on, as we said, sexual debut, but most of the time from the age of 21 to 29 years. We can do pap smears on its own every 3 years. So initially you may do it yearly for 3 years, then after that every 3 years. From 30 years to 65, you may actually still do the pap smear alone, but also combine what we call co-testing. So do both pap smear and HPV test. So if you're able to do the co-testing, it will actually be every 5 years. Okay. So we mentioned the age of 65. So at 65, you can actually stop doing the pap smears or the co-testing as long as your previous 3 pap smears within the last 10 years have been normal, and the last pap smear was within 5 years of 65. And for co-testing, you can stop at 65 years if your the past 2 co-tests were negative. Yes. Yes. So the other screening test actually in our setup, testing for the HPV itself, the causative agent, is the primary method. So the test will actually pick the specific HPV that you have, whether it is high risk or low risk, and this will enable us decide on the way forward. So the beauty with HPV, it can actually be self-collected, because we know sometimes women get ashamed in terms of the way we collect the pap smears, the exposure that we take them through, but the HPV test can actually eliminate that. But also the physician can actually collect the HPV test on their own. If these 2 are not available, especially in very low resource settings, our rural areas, we also have the visual screening test we call via villi. So in this one, we actually use a liquid. We spread it on the cervix, and if there are any abnormalities, we get specific color changes, and we are able to institute further management depending on whether it's positive or negative. Yes. So for everyone, or for all women, there is a test that they can actually have, and we really encourage them to go for these tests. They are available everywhere, even in the lowest hospital levels, including our community hospitals. Yes.
Wow, thank you very much, Dr. Moita. That is very interesting to our ladies. If you are watching this video, I encourage you that you make your comments about what has been your experience with the cervical cancer screening. What are some of the fears that you have about screening? You have heard that screening is readily available. The VIA is very affordable. It is very quick to do, and you get the results there and there. So we don't have a reason why we should take ourselves through the devastating effect of cervical cancer when these screening tests are available. And then the human papilloma virus, there is 2 parts. That there is the doctor, where the specimen can be taken by the health provider, or even the ladies can take the samples and present them at the laboratories to know whether they have a human papilloma virus. So let's take the opportunity and screen for cervical cancer. Remember, January is a cervical cancer awareness month, and you can take this opportunity to go and screen for cervical cancer. Please take the opportunity. Now let's continue with our talk on cervical cancer. Now, Dr. Moita, tell us about what is the burden of cervical cancer worldwide, also in Kenya as a country, and how does cervical cancer present?
Okay. So the burden of cervical cancer worldwide, one, I'd say it is the fourth commonest female cancer worldwide generally.
Okay.
That is after breast, colorectal cancer, and lung cancer. So like in the year 2020, we had almost 600,000 new cases, and with around 350,000 deaths. Yes, so you can see how devastating the disease is. And remember, out of these 600,000 worldwide, 85-90% are actually from the low middle income countries, obviously Kenya included there. So in Kenya itself, cervical cancer is the number one cause of death amongst the female cancers that we have. But it trails breast cancer in terms of numbers. So breast cancer is actually the commonest, but cervical cancer kills more. Okay, so in 2022 we had about 5,000 new cases, and with a mortality, or we lost 2,500 of them. So you can imagine losing all these women to a disease that we can prevent. Okay, yes. So it means as also public health care experts, we have a lot of work to do on this disease. You know, it reminds me of the 80s. You remember when HIV came out? You remember the campaigns that we had? Billboards everywhere, radio stations, talk shows everywhere. But it's surprising, something like cervical cancer, which can be prevented, early stages can actually be cured. We do not have these kind of campaigns. You don't hear people talking robustly about this. So we have a lot of work to do about this.
It actually really saddens me when you talk about cervical cancer killing almost half of the people who get it. What leads to this scenario that half of the people who have cervical cancer ends up dying prematurely?
So what we are seeing a lot is that women are presenting quite late. You know, if you present in late stage 4 maybe, treating the disease is quite difficult. You can imagine even the cost of treating the illness itself is beyond most of the Kenyan families. So even most of those who start the treatment actually default. They stop on the way, maybe because of side effects, maybe because of the financial implications. So we are losing a lot. So if we were able to catch the disease early, if we were able to screen enough, if we were able to vaccinate and reduce this, we would change the story completely. And we have seen in developed countries, those that started screening their young children early 2000s, 2004, 2005, they have really reduced the burden of cervical cancer. In fact, if you look at literature, the studies that have been done, those the young girls who received the vaccines 20 years ago, they have not even presented with the early changes that we see with cervical cancer, which means it is actually something that is working. Okay, so my prayer or my plea to the parents usually is sometimes, let us trust in science. We are using so many things that have been created through science, that our transport, the drugs that we take, the food that we eat, isn't it? So I do not think the HPV vaccine would be something someone would be against, knowing the kind of effect it has had in other parts of the world. So I encourage parents to take their children for vaccination.
Wow, that is very good news that the human papillomavirus has actually brought a revolution in the treatment and prevention of cervical cancer. And the good news is that the human papillomavirus vaccines is available in our country, and it is accessible to all of us. So tell us, who are the people who are eligible to get the human papillomavirus vaccines?
So the human papilloma vaccine, currently, even in our setup, Kenya, we are giving it to girls aged 10 to 14 years. But we have to note that even boys should receive the vaccine. So in as much as we are talking about 10 to 14-year-olds, the vaccine can actually be given. The one that we have, or the one we call the quadrivalent vaccine, can be given to girls or boys even up to the age of 25. But we also have newer vaccines, the 9-valent, which protects you against 9 strains of high-risk HPV, that can be given to women up to the age of 45. Yes. And as what I would say is that the vaccine is very effective. From what we have discussed earlier about nations that actually started giving this from the early 2000s. Yes.
So very effective vaccines are readily available. So let's take that opportunity. Please share this video for those whom you think that might benefit, so that we all join in this battle against cervical cancer. Now, Dr. Limuita,
Yes.
how does cervical cancer present, and at what point should a lady start suspecting, could I be having cervical cancer?
Okay. So in the very early stages, usually there are no symptoms or signs to report. Usually they don't present with any symptoms in early stages. And I repeat again, that is why screening is very, very important before we get to this stage. So if left untreated, now in the later stages, okay, that is when you will get bleeding in between your menses, low abdominal pains, swollen limbs. But usually a very important sign is bleeding after sex. That is usually a very important sign. And if you have this symptom, you have to go to hospital and get checked. Okay. There are obviously other symptoms that will present in now very late stages, because the disease can spread to other parts of the body. But usually those are the early signs, but usually indicative of later stage of the disease. Yes.
So thank you very much. Let's remember that screening is the core thing. Remember that early stages there are no symptoms, and when the symptom present is usually with a change in your menses. So if there is anything that you have doubts about your menstrual flow, please see your health provider so that you can get help on time. Let's avoid this aspect that we are losing half of women who have cervical cancer are dying prematurely because of a disease that can be very easily, with very simple tools that Dr. has put it. It's like the string that David had, and he just needed to strap, and Goliath was gone. And this is how cervical cancer is. So what are the options that you have now when you have been screened, you have found that you have abnormal changes in your cervix? What options do you have, and where do you start?
So with the screening, as we have talked about, the very early changes. You may not even get any treatment per se, but your doctor may advise that we just follow you up the very early changes, which can actually disappear, okay, from the cervix. But with the later changes, but precancerous, we have options like cryotherapy. This usually is a procedure that is done to freeze the abnormal cells. We have procedures like LIP. So this one actually removes the diseased part of the cervix, is actually cut off. We have procedures like conization. Also, this is a procedure that removes the diseased parts of the cervix. And remember also, in very early stages again, we can do what we call trachelectomy, that is removal of the cervix, especially for those who want to conceive but they have very early disease. Okay. Now, for the general treatment of those who already have overt disease, stage 1. So for stage 1, we can actually do surgery and remove the diseased uterus. Okay. But still, the other option is actually doing what we call radiotherapy. So stage 1 has those two options. When you get to later stages of the disease, surgery may not be an option. So in this case, depending on where the stage is, you may need what we call chemotherapy combined with what we call radiotherapy. But in very late stage, stage maybe 4B, that would be mostly chemotherapy. We are getting to a place where we offer palliative care to this patient. Yes.
Okay, thank you very much, Dr. Moita. You have talked about the early stages of the cancer, and you have talked about procedures that can be done, which include the freezing of the abnormal cells. There's the cauterization of the surgical, the electrical, electrosurgical
yes.
excision of the abnormal cells. Now, for the sake of the people who might need these procedures, and also for the health providers who are screening for the cervical cancer, where are these procedures available? Who does them? Is it you just as a gynecologist who does it? Other gynecologists doing it? Either health providers able to do these procedures? How available? So that when we are going for the screening, we know that these are the options that we will have after we screen.
So these procedures are actually available from level 4 facilities, and we have gynecologists trained to do these procedures, and apart from that, we are also empowering our medical officers, because as you know, we still have a paucity of staff. The gynecologists, the gynecologists are even fewer, so we have to train our medical officers to be able actually to do these procedures. So they are available. Yes.
Okay. So thank you very much, Dr. Moita. You have taken us through what is cervical cancer, how does it prevent, the screening methods available, the treatments available, and you have presented to us the challenge that we have is that our women are presenting late. We are not going in enough numbers to screen for cervical cancer. What would be your take-home message to the people who are watching us to prevent and to fight this cervical cancer? WHO has said that 2030 we should be able to eradicate cervical cancer. Are we almost there? Are we getting there? Are we nearly there? So what would be your take-home message to our women, to the policy makers, so that we are not caught up unprepared and we get ourselves, we are still struggling with the cervical cancer come 2030?
Yeah, you have mentioned the WHO targets, the 90, 70, 90. So the target is actually to get 90% of our girls below 15 years vaccinated. Unfortunately, we are still doing poorly there. We have very low vaccination rates. Yes, I think maybe less than 30%.
Oh, very sad.
That is very sad. For screening, so WHO says that 70% at least of women to have had as a screening method. We are talking about HPV being our primary screening test. Also, again, we are doing very, very poorly. Then 90%, the other 90% is for our women who have precancerous and cancerous lesions actually getting the necessary treatment. Again, we are doing poorly in that area, but there is hope, isn't it? What we are doing is that we are training more specialists in the oncology field to go to various parts of the country, and I believe these people will be the advocates for our women. Okay, and as I said earlier, the biggest message that should go outside there concerning cervical cancer is that it is preventable, isn't it?
Yes.
So what we are urging everyone is to be the David in this story, and this starts from the home, because we have children, we have girls getting to that age. So it is us as parents who should encourage, take our girls, take our boys for these vaccination. And as we have said, in the long run, with the changes we have seen in the more developed world, this is not something that should even be bothering us. If we are doing the vaccination, it will be the least of our worries in the next 20, 30 years if we start the process now. Yes.
So if you are still watching this video and you have come this far, I urge you that you subscribe to this this channel, The Overall Health, and I encourage you that this is a time for action. We have a task at hand. We need to eradicate cervical cancer. I think we can do it, and we have the capacity, we have the capability. So if you are ready and you have not taken the step to go for cervical cancer screening, do it now. If you are a mother or a father and you have girls who are in the stage of 10 to 14 years and they are eligible for going for the human papilloma virus vaccination and they have not been vaccinated, don't wait for tomorrow. Please take them for the human papilloma virus vaccination now. This is a disease that we can beat. This is suffering that we can eradicate. So let's take the action now. So thank you very much, Dr. Moita. Thank you for that enlightenment. I'm very delighted that you accepted to come and share this very important knowledge about cervical cancer. And as viewers, let's take the necessary action. Please leave your comments why you have not gone for a cervical cancer screening, or why you have not taken your child for the human papilloma virus vaccination. And if you have done it, please share also your comments. What was your experience? So that those who also have not done it, they may get encouraged and they know that these vaccines are available, they work. And the testing is very simple, it is pain-free, just a bit of discomfort. But the discomfort of a screening test is not comparable anywhere to the devastating effect of cervical cancer treatment. Thank you very much for watching. I encourage you, let's keep watching. Thank you very much.